Can you hear me? Good morning.
Hey, good morning. I can hear you now. How are you?
Hi, I'm doing fantastic. Happy to be on this morning.
Well, we're always happy to have you on with us as well. Well, Hope, methods to alleviate knee pain without surgery. Thank you very much. You came just a little bit too late for me. I just had knee replacement last September, but I can use the tips on the other knee. So this is great.
Well, good. Well, and this topic came up because a month ago, a few drivers reached out asking about knee pain, and I thought this would be an appropriate topic to talk about on your show this morning.
Absolutely. And so many people are suffering from knee pain, today, and I guess probably always, but especially I've been hearing more and more over the past few years. People that I just run across, and on a daily basis, almost, just even at the store or, some other place of business. And I hear people talking about their knees, or they're in conversation with me about, how bad their knees are hurting. So yes, and our truck drivers are no different. So a great topic. So where do you start with the knee, the knee pain and alleviating that?
Yeah, I think for a lot of people that are listening, first of all, I want to validate that your knee pain is real. Like you are having pain for sure. And there are definitely situations, Tim, where you're bone on bone. You've been rubbing for a while. Like, this is where I love Western medicine, to be able to step in and give someone like yourself an artificial knee with the proper recovery patterns afterwards. Go on and have a really high quality of life, and to be able to get back to doing many of the things that you once loved. But I've worked with thousands of people's bodies over the last 25 years in various settings. And one of the things that I have noticed over time is that a lot of people are confusing knee pain with actually neighboring issues on that lower body. And with some proper exercises and realignment, they can dramatically reduce some of that pain. And so let me explain a little bit. When we look at the knee is kind of caught between the crossfire of the hip and the foot and ankle. And so sometimes when people are experiencing knee pain, I know I have at various times, we're feeling that pull, that kind of struggle between what the foot wants to do and its musculature, and what the hip wants to do and its musculature. And caught in the middle is the poor little knee and its kneecap that doesn't really get a choice in the matter. And for someone like a truck driver or somebody that sits a lot, that constant 90-degree angle at the hip is shortening some major muscles that are actually pulling up on the kneecap, because that kneecap is a floating bone. It is not like your shoulder, where it's a distinct ball and socket, where the one bone sticks fairly nicely into the other, and unless you really do something, it's not really coming out. The kneecap's not like that. You can kind of slide your kneecap around a little bit, and it's just there. It's there hoping that the musculature that keeps it there is doing what it's supposed to be. And that's the quadricep muscle. That's your thigh muscle. That quad muscle has 4 heads and kind of turns into, you may have heard, the patella tendon, and attaches over the kneecap. But when that quadricep muscle is so tight, and we can actually check this. So the next time, listeners, that you're driving, or not driving, that you're not driving, stand up and try to stand and just relax your thigh muscles. Like, make them go really soft. And for a lot of people, Tim, they can't do it. They can't get their quad muscles to disengage. And if they look at their legs in the mirror, they can see that kneecap is slightly elevated. Why does this matter? Because that creates constant rubbing in the knee. That friction eventually turns into inflammation. And now we have knee pain. Now we have real knee pain that wasn't exactly caused by the knee.
That's very interesting too, to look at it like that, just the way the descriptive way that you described it, and it makes a lot of sense. So if you cannot get that muscle to disengage, what's the next step?
Well, now it's looking at some simple exercises that you can do to try to relax that quad, because for a driver, not sitting is really not an option. Like, then they don't have a job. And so it is about kind of combating some of those habits and patterns that could be causing some of that knee. So if we're talking knee pain, if we're talking specifically about the quad, a really simple exercise and stretch is the next time you're sitting on like the edge of a bench or a chair without arms, is to do what's called a low loose lunge and hang, let's say, your right leg off the side and hang that knee straight down below the hip. So try to keep that pelvis nice and upright and let the leg just hang down. And that's actually a really good stretch, but also a great sign for you. Does my leg want to hang straight down, or is it kind of yanked forward by that hip and quad tension? And so you're kind of getting 2 for 1 here. You're checking to see, again, how tight is that quad? You know, how much is my body being pulled out of alignment? And I'm going to get that nice hip and quad stretch. And this is one where, again, I'm just focusing on trying to relax the leg. So much of the people that I've worked with over the years, when it comes to stretching or getting rid of pain, we have this like forceful nature, Tim. This like, if I'm not feeling something rip off my body or push really hard, this clearly isn't effective. And a lot of the things that we can do to realign and rehab our body, like our knee area, requires us to kind of step back and relax a little bit and let our body kind of let go, because we've been carrying so much tension that's causing some of this misalignment. So that low lunge, kind of hanging leg stretch on a chair is something you can do whenever you're sitting, especially on that tight hip and that tight leg, and just practicing that and just opening that up to try to get that quad to relax. But like we said, there's another part of the leg, and that's the lower leg, so below the knee, from the knee to the foot. And a couple of things we want to look at when it comes to knee pain is we've all been walking since the beginning of time, since our parents, probably 2 years old, gave us our little pair of shoes. We've been walking around, cruising around, and we've created some different habits over time that's kind of created that alignment and that knee issue. So looking at that lower leg, specifically the calf, this goes back to a lot of sitting, or if you do a lot of walking or running or jumping, that calf muscle gets really short and really tight. That's going to create a lot of tension on the lower leg and essentially on the knee. So stretching the calf is really important. That's hanging your foot off the truck step, that's standing up and just taking a slight step back with one leg and trying to bend that back knee as much as you can without lifting the heel. Those types of stretches, again, really simple, are going to release the muscles of the lower leg to try to get that knee to what? Relax. That's the name of the game. We got to get those muscles to relax.
Absolutely. 615-292-6366. I have an email for you, and I'll read that email now, and you can address it on the other side of these messages, Hope. And he says, I have 2 bad knees. The right knee is much worse than the left knee. It's to the point where it hurts getting in and out of the truck, and I can't park far from the truck stop, the entrance to the truck stop, that is, because of the pain of walking. When do you know that it is time to get more help as far as my knees are concerned? So we'll get the answer to that on the other side of these messages. This is Tim Ridley along with Hope Savara on the Tim Ridley Show on Sirius XM. Hope Zavara is with us. The topic this morning is methods to alleviate knee pain without surgery. Hope, our road dog wants to know basically is how does he know when it's time to go and get help?
First of all, I think if anybody is having knee issues and they're starting to think, man, is something really wrong? I always think, Tim, it never hurts to know, right? Like, am I bone on bone? Is there major inflammation in there? And I know I'm guilty of this. I sometimes wait. I wait because I'm just like, that process of having to deal with anything along those
I'm the
lines
same
is
way.
just frustrating. But I'm always under the mentality, you know your body. And one, I am not a doctor. I've worked with a lot of people, on the physical level and mental level, but I always follow your intuition. And I am always in the party of, it's always good to know. It's great to see, what is actually going on. So then you can take proper action. But if you're like, in the meantime, are there some things that I could possibly do to, help improve my knee pain? That's something I think we can all benefit for, even post-knee surgery or post-knee rehab, whatever that may be. But if you're hearing things like clicking, popping, you have constant redness and inflammation, your knees are hot to the touch, or maybe, you just feel like it feels like there's some saw boards going on in there. Like, those are good signs. You might want to just go, okay, this is not how it's supposed to be, and just go get an opinion, go get them checked out, and see what they say. Because if everything is fine, and sometimes weight is a factor, a lot of weight on your knees can definitely create some issues. I like to think of it as almost like artificial issues. Like, okay, I have knee pain, but it definitely ain't my knees. Something else is going on, and it's the load that my body has to carry. Well, then now we know where the focus needs to be. We have to focus on losing weight. And some people are like, well, that's too hard. Well, eventually you got to choose. Do I want to blow my knees out because I'm carrying a lot of weight around? Or do I want to focus on the real problem, which is maybe I need to focus on my weight to be able to keep my knees, save my knees, be able to avoid a surgery long term. But other things we can look at and think about. One of my favorites, Tim, and has made actually a big difference in strengthening my knees, are simple exercises like walking backwards. And so walking backwards is a great way to create stability and strength in the knee. Now, you don't have to walk backwards everywhere, but just doing, a few strides every single day, a few laps around your truck to help build some strength around and in the knee is a simple exercise that often gets overlooked. Another one is calf raises. I know we talked about loosening the calves or creating more flexibility in the calves, but a tight muscle is not the same as a strong muscle. And so we need to also strengthen areas that sometimes feel like tight or restrictive. And so that calf muscle is one of them. Another area that we can think about and try to stretch is called the iliotibial band. It's down the side of the leg from the hip to the knee. Now, that's one of our largest fibrous bands in the body. That big, huge flat band down the side of our leg, like your pant seam, our quads, our hamstrings, our glutes attach onto that. And when that guy gets tight, it yanks on your knee. Now you have this weird pain on the side of the knee that you can't figure out where it came from. So using a massage gun, working that through, trying to stretch kind of a lateral or side body stretch. Those are some simple exercises that you can be doing daily to help mobilize and strengthen the lower body to get yourself back to where it is your body intended to be. But the last thing that I'll say is, if you do nothing, you're going to get nothing. And so if we just kind of sit here and go, my knees hurt, my feet hurt, my back hurts, but that's where it ends. Even post-surgery, you're going to end up with the same issues. Why? Because you're still doing the same patterns. I bet, Tim, after your knee replacement, they had you in physical therapy doing what? Specific exercises to rehab and strengthen those muscles.
Yeah, that's right. Well, we have Bob who wants to speak with you, Hope. Bob, good morning. You're live on the show with Hope.
Good morning, Tim. Good to talk to you. It's been quite a while.
Yes, it has. Great to hear from you.
I'm an 81-year-old driver, and I'm prescription drug-free. And
that's great.
I do a lot of natural supplements, and I've taken collagen probably for 25 to 30 years. And because of the supplements that I take, I have absolutely no knee or hip pain. My knees and hips are better than when I was 30 years old. And attributed that to taking supplements.
I love it. I love it. Wow, what a testament to taking care of your body and taking care of your health. And moving, right? Keeping your body moving and keeping the fluids and keeping everything lubricated is so important. So that is great. What a great testament.
Another thing, I am grain-free. I do not eat any grains. From what I've read, grains can cause inflammation.
Yeah, which we touched on earlier. And so that chronic inflammation is heavily linked to diet and heavily linked to eating, high processed foods. And for some of us, they affect us more than others. And so sometimes joint pain or kind of mysterious pain can be heavily linked to chronic inflammation in the body. It sounds like you're doing a lot of great things.
Well, thank you for taking my call, and both of you have a great day.
You too.
Bob, you too. You've been an inspiration to a lot of people. You keep up the great work, Bob. We appreciate you, brother. All right. That is great. He says his knees feel better than they did, when he was much younger.
Yeah, well, and some of the things he was talking about, and again, this is just a candid conversation, we're having today. And looking at nutrition, he was talking about, taking supplements, looking into that collagen. Our body, our musculature is made up of specific vitamins and minerals. And when we're lacking those things, we're going to start to feel the effects of that. And so this is another great reason, to go to have a conversation with your doctor and let them know what's going on and ask them what you can proactively do to help avoid issues in the future, like a knee replacement. What can I do to improve my joint health? Glucosamine is a great thing to look into. MSM is a great thing to look into. Things that can help, again, reduce that inflammation, improve that mobility, improve tissue health are never going to hurt you. They're definitely going to help you in the long run. But obviously do your homework, do your research, talk to a medical professional, because there's a lot of stuff out there that does a whole lot of nothing. And so make sure you always do your research, regardless of what direction you go with your health.
Yes, that's for sure. And it's no fun walking around with bad knees, is it?
No, it's not. I have one last thing for listeners to think about. The last thing, and this didn't really occur to me until I started studying more of functional movement, and it's the shoes that you wear. And so heeled shoes, even for men, having a heel in your shoe, think like a dress shoe or like a cowboy boot, having that heel in your shoe changes the pitch in your body, changes the angle in your body, and creates an increased risk for knee osteoarthritis. And so looking at the shoes you're wearing to change essentially how your body should be in an upright position can negatively affect the knees. So again, sometimes the knee really isn't the issue. It's simply taking the brunt of the problem from other patterns, other lifestyle habits, and other tissues and joints in the body that the knee is just caught in the crossfire. And so my suggestion to listeners is, like all things in life, what is one small change that I can do today to actively support my knee health? We don't need to do 20. We don't even need to do 5. What I want you to think about is, what is one thing that I can add to my regimen that I can start to think about to improve my knee health? Because if we can avoid something like a replacement, if we can avoid something like injections, and we look back and be like, oh, I could have done that, I should have done that, today is a great day to start.
And most of those are just very simple steps as well. And I was going to ask you about shoes, and I'm glad that you addressed that, because I had heard that many years before. So the change in the pitch will have a negative effect on your knees.
Yes, yeah. And so it creates a shortness in the hip flexor, a tightness in the calf, which kind of creates a little bit of a pulling back and forth on what joint? The knee joint. And so if you're used to wearing a pretty cushioned, high-heeled pitch shoe, men or women, men have a heel in their shoes, Start small and just slowly start to step down from that heeled shoe. A lot of boxes on shoes that you buy will tell you the incline on the shoe or the pitch on the shoe all the way down to a neutral, and you can slowly work your way down. The other rule, and my kids love me and hate me for this, is if you can't fold your shoe in half, you can't buy it. And so that lack of mobility in your shoe is like walking around with a cement brick on your foot every day. How do you expect your knee to fully function and move if the joint below it has no movement and is restricted as well? Remember, tightness travels, and many of our body parts from the ground up are simply reacting to what is below. It's like a roof leak. If you have a big crack in your foundation, it can actually affect the rest of the house above it, and that foundation over time can, in fact, create roof issues. Your body is no different. Today is the day you start to take care of your body. Today is the day you start to move yourself forward in advocating in proper, healthy ways. Today is the day that you begin to pay attention and take care of your knees, because replacement parts are never as good as the originals.
Hope, thank you so much. We certainly appreciate you, and thank you for all you do. Have a great week, the rest of your week now.